Good day, fellow learners. Once again, this is your mentor, your fact check buddy, Gapuz, joining you for PECHA KUCHA number 8. And for this PECHA KUCHA, we're going to be covering concepts, which I call the dangerous Ds, which means these are 20 manifestations that if you find in your patient, you may need to prioritize this as this can potentially lead to more serious conditions. So each of these dangerous Ds can potentially lead to complications which may need the nurse's immediate response. So before we get to start, let me first share with you what a PECHA KUCHA is. It is actually a format of storytelling that utilizes 20 slides, with each slide being commented on for a maximum of 20 seconds. So the method usually lasts for 6 minutes and 40 seconds. So which means in 6 minutes and 40 seconds, you will be able to recall concepts that are essential for you to remember as you prepare for your test preparations for your nursing exam. So without further ado, before anything else, let me ask you to join me in this mission. Our goal is to provide free NCLEX RN application and review to 100 nurses. And to help us achieve this, just watch and finish the ads in our videos. Thank you so much in advance. This time around, it's for real. Here we go. Let's begin our PECHA KUCHA. Dysphagia is actually a problem for patients with difficulty swallowing, and it's usually manifested by drooling. So we have to refer them to speech-language pathologists. So pay particular attention to the fact that these patients could be in danger of aspiration. And it's very important for you to note this danger. Next, dysarthria is actually weak speech muscles, and this is manifested through the presence of slurred speech or slow speech, which is something that you can note for a patient with stroke or CVA. So, like a patient with dysphagia, we refer them to a patient with speech-language pathologies. Dyspnea is air hunger or shortness of breath or difficulty breathing. We usually find this in patients with asthma, COPD, and even those with heart attack. So the priority intervention should be to keep the patient upright. And if it's not relieved, then we bring them immediately to the hospital. Next, drooling. This is usually found in several conditions. The code is CAPS. So cerebral palsy, amyotrophic lateral sclerosis, Parkinson's disease, and of course, stroke. We need to refer the patient to a speech and occupational therapist. So patients with drooling would be at risk for aspiration. Diplopia is found in patients with myasthenia gravis, multiple sclerosis, stroke, and brain aneurysm. So double vision is usually corrected by asking the patient to wear eye patch or have eye exercises or surgery if it's not relieved by eye exercises. Next, decreased level of consciousness could be associated with a head injury or stroke, could also be associated with alcoholism, drug abuse, specifically cocaine and methamphetamine, and of course, hypoglycemia in a diabetic patient. So the priority should be to stabilize your ABC, airway, breathing, and circulation. Dizziness, or a feeling that the room is spinning or you feel revolving or rotating, it's found in patients with Meniere's disease or motion sickness. The priority is to instruct the client to sit still, close their eyes, and place them in a darkened room or to lie down. Next, dysuria is usually manifested by burning in urination. This is associated with urinary tract infection, and the common cause of this could be ascending infection in both males and females. So the treatment would be administration of antibiotics. Next important thing, you have your dementia, which is manifested by loss of cognitive function. So remember this, colleagues, in dementia, the priority is orientation because it's a cognitive problem. So it affects thinking, remembering, and reasoning. Second priority would be safety. And the common cause would be your Alzheimer's disease. Now, this could also be associated with Pick's disease. Now, dehydration is loss of body fluids in babies. It could be manifested by sunken fontanelle. But take note, for babies who are less than 6 weeks old, the absence of tears is expected. So absence of tears could be a sign of dehydration, if your baby is more than 6 to 8 weeks old. Okay, so the priority is to monitor the weight and the urine output. Next important thing is depression. So the patient would have feeling of sadness, and this usually lasts for more than 2 weeks. So the priority is to assess the patient's suicidal ideation and refer them immediately. Assess using a direct questioning. Next, dry mouth or xerostomia. This is found in Sjogren's syndrome, which is an autoimmune disease characterized by dry mucous membrane. So they will need artificial tears, artificial saliva, or you can ask them to chew on sugarless gum or ice chips. This is found in, once again, Sjogren's syndrome. Next, dystonia, involuntary muscle contraction, which could be associated with Parkinson's disease, Huntington's disease, Wilson's disease, and stroke. Pay particular attention that dystonia could contribute to slowed movement or bradykinesia in both Parkinson's and Huntington's disease. So treatment would usually involve relaxing the muscles, sometimes using Botox or botulinum toxin. Next, diarrhea. This is associated with Clostridium difficile, norovirus, shigellosis, giardiasis, in which a complication could be dehydration. So the priority would be monitor electrolytes and implement the appropriate isolation precautions. Next, you have deafness. The risk factors could be, remember, LAN, loop diuretics, antibiotics, and your non-steroidal anti-inflammatory agents like your aspirin. Okay, so the treatment would involve the use of hearing aid, in which case you have to instruct the patient about the do's and don'ts. So it should be that they have to be oriented on what are the things that they can do and they can't do with their hearing aid. Next, deep vein thrombosis. There are 3 factors that could lead to this. You have increased blood viscosity, trauma to the blood vessel, like an injection, and immobility. The prevention would involve the use of your intermittent pneumatic compression device that should not be worn when going to the comfort room because it increases the risk for falls. And anticoagulant should also be used. Dunn's sign in intussusception is described as the feeling of emptiness on palpation of the right lower quadrant of the abdomen. Now, this indicates the presence of your intussusception, which is the telescoping of the intestines. Next, decubitus ulcer, common risk factor in the elderly would be shearing force. That would be associated with sliding the patient on bed. So stage 1, take note, hydrocolloid film is used, and for stages 2 to 4, hydrocolloid foam is usually used as a dressing for patients with decubitus ulcer. Next, dental caries. A common risk factor for dental caries would be the use of anticonvulsants that would cause gingival hyperplasia, which necessitates a frequent visit to the dentist. And this is usually found in patients with cerebral palsy. So it's very important. Patient with cerebral palsy should visit the dentist regularly. Next, dysthymia is persistent depressive disorder, or it's also known as chronic depression. Depression usually lasts for 2 years in a patient with dysthymia. So you have to assess them for their potential risk for suicide. And that's important for you to remember. So dysthymia is chronic depression. And that ends our PECHA KUCHA. And that ends our PECHA KUCHA number 8. This is your mentor, your fact check buddy, Ray Gapuz, saying a functional concept a day keeps your NCLEX RN fears away. So I'd like to invite you in our next PECHA KUCHA video. That's going to be PECHA KUCHA number 9. So let's learn together. If you have any topics which you may want me to cover in my next videos, whether that's going to be PECHA KUCHA or quick fix for the NCLEX, send in your request to my email, mentor.raygapuz@gmail.com. If you love this video, please don't forget to subscribe, share, and hit the like and bell buttons. And if you want me to cover something else, send me an email through my address. See you in our next video.